Welcome to a presentation on collaborative ABA services. We are a Purdue Global Partner located out of Middletown, Connecticut. I am Alisha Simpson-Watt. I am the Executive Clinical Director as well as founder of Collaborative ABA Services. So who are we? So Collaborative ABA Services, we are a BHCOE accredited as well as an award-winning behavioral health practice. We provide services to children and adolescents ages 2 to 18 and their families that are impacted by autism and other development or behavioral disorders. We specialize in applied behavior analysis therapy, but we also use an interdisciplinary approach to treatment, as we have a unique team including occupational therapists, occupational therapy assistants, speech and language pathologists, social workers, in addition to our wonderful BCBAs and behavior technicians. Our mission at Collaborative ABA Service includes importance of partnerships and working together towards a common goal. So we believe that in working together as a team, that we can mobilize resources and promote meaningful changes in a child's skills and behaviors. So we have the motto of building partnerships, building skills, and building futures. Where did we start and where we're going? We started out in June 2019 with just myself, and then later on included 2 behavior technicians. We were providing only in-home and telehealth ABA services. Once we continued to expand, we moved on to also including social work services. And then in September of 2022, we opened our first clinic in Middletown, Connecticut, where we expanded additional services to include occupational therapy as well as speech therapy. What services do we provide? Of course, we provide in-home, center-based, and virtual ABA therapy, and we provide it to Middlesex, Hartford, and Tolland counties in Connecticut, as well as Meriden. But we also offer school-based consultation. We do parent or guardian trainings, as well as caregiver groups. We also do community trainings for professionals, as we are an ACE provider. We also provide diagnostic evaluations for autism, professional supervision for students like yourselves, including board-certified behavior analysts, as well as board-certified assistant behavior analysts. And we've also had social work students, as well as speech students. We also offer social skills groups, occupational therapy, and speech therapy. Some career paths at Collaborative may include starting as a behavior technician and growing into the position of a board-certified behavior analyst or a board-certified assistant behavior analyst, becoming a social worker, occupational therapist, occupational therapy assistant, as well as a speech and language pathologist. Our supervision model consists of, first off, being aligned with the BACB requirements. And that means having those supervisor credentials and also experience to provide you a valuable supervision as a student. We provide individual or one-on-one as well as group supervision to allow students to also get that support with peers who are also enrolled in programs, in addition to having that one-on-one time with your direct supervisor. We also offer direct observation and feedback, clear expectations, and ongoing support. For example, all of our students do sign a contract that is also signed by all of the BCBAs that are in the practice to ensure that that student does get their hours covered in the event that they may have different cases and have different experiences, and we're still compliant with the BACB. We also continue to make sure that we're up to date on our BACB supervision requirements. Some direct and indirect student experiences may consist of assisting with treatment integrity or IOAs, conducting preference assessments with clients, utilizing literature to help with decision making in regards to navigating treatment planning, skill acquisition and behavior plan development and implementation with the supervisor or BCBA, staff or parent caregiver trainings, data collection and graphing, conducting and assisting with functional behavior assessments, analyzing data, making those clinical decisions, assisting with discharge planning and development of discharge plans, interdisciplinary collaboration with other providers on the team, implementing ethical decision making and documentation, and also that group experience. So some student perks here at Collaborative include having that one-on-one supervision with that designated BCBA that also is aligned with your case and very familiar with the kiddo that you may be working with. Also having group supervision, which we do have at our site several times a month. And it's a great experience for students as they're able to work and meet other students that are also enrolled in programs and working towards their hours. Also, as a student, you're able to attend CEU events with BCBAs. And again, because we are an AC provider, we also offer CEUs in-house, as well as because we're also accredited by the BHCOE, students also have access to our online CEU modules as well. Also, you're gaining experience across different settings. So in addition to working in the clinic setting, we have opportunities in home as well as in the school setting. And then also, we are partnered with Purdue Global. And so because we have a partnership, you also would receive a tuition discount. So what are some expectations of students that are at Collaborative ABA Services or interested in Collaborative ABA Services? We do ask that you are enrolled in an ABA graduate program such as Purdue Global. We also ask for a minimum weekly hour commitment. Right now, the minimum is 6 hours because we understand that some students may work full-time jobs, or they might go to school full-time, or they have other obligations. So we try to be as flexible as possible, but the minimum amount of hours that they have to commit to a case is actually 6 hours a week. We also request professionalism and also maintaining those ethical boundaries or behaviors. We also want our students to be openness to feedback because having feedback is very important to your professional development and growth, and also being an active participant in your supervision sessions. And we always ask students to come to your supervision sessions with an agenda so that we can ensure that you're getting the most out of your experience. So these are some feedback from our previous students that were part of our cohort in the past. We do like to give out surveys just to get some feedback on how we're doing as an organization supporting our future BCBA students. So in this feedback, it says, I receive enough feedback, both positive and constructive, on assignments from my supervisors to prepare me to be a BCBA. And 100% of the students completing the survey said that they strongly agreed. My supervisors are attentive to my current abilities and training needs. 100% of the students felt that they strongly agreed with this statement. Supervision addresses the BACB task list and ethical and professional guidelines in the field. So it looks like about a little bit over 30% of the students agreed with this statement strongly. And then it looks like about 65-ish% of students agreed with the statement. Supervision enhances my ability to make clinical decisions and solve problems. Approximately about 65% of the students indicated that they strongly agreed with this statement, and about 33% of the students agreed with the statement. So overall, we had an average rating of about 4.7% from students that felt that overall there was a positive experience in obtaining supervision with us at Collaborative. So some tips for entering the workforce as students. You want to definitely learn beyond the textbook. So getting that hands-on experience is very essential to help you become a well-rounded behavior analyst in the field. Because textbooks are great, but they may not always have the right answer to situations that happen in real time. And so being able to think outside the box and having that hands-on experience makes you a well-rounded clinician or provider. Also being mindful of your supervision or the quality of supervision that you're receiving. Great supervision equals better outcomes. So you want to use supervision as an opportunity for learning and professional growth. You don't want to just be there to accumulate hours. And also being mindful of the quality of supervision that you're getting, making sure that whatever location that you decide to go to, make sure that they have that person that has the time and energy to invest in your growth and development as a future behavior analyst. And also think about long term. Like, where do you want to be in 5 years? And will this position help meet your goal? Like, if you're looking at working in a clinic setting, or if you're looking at working in home, making sure that your experience aligns with what your end goal is going to be. Thank you and also feel free to connect with us at Collaborative ABA Services. Our website is www.collaborativaabaservices.com. You can give us a call. Our office number is 860-421-4052. And this is my personal email, or direct email is alicia@collaborativaabaservices.com. And also feel free to follow Collaborative ABA Services on Facebook, Instagram, LinkedIn, TikTok, and also YouTube. Thank you.